Thank you for taking time for Hemp. I'm your host, Casper Leitch. You are listening to an encore presentation of Time for Hemp Live. Time for Hemp Live is heard every Monday through Friday on AmericanFreedomRadio.com from noon to 1 p.m. Central Standard Time, which is 10 to 11 a.m. Pacific Standard Time and 1 to 2 p.m. Eastern Standard Time. I ask that you and your friends make it a point to tune in. With that said, let's take Time for Hemp.
Look at all that money, yeah, the money that they spent. Take another look and take some time for hemp. Don't cut trees for paper, cause it hurts the environment. Stop deforestation, yeah, it's time for hemp. An acre of hemp makes 20 barrels of oil. No need for pesticides to poison all our soil. People got no food, they got no clothes, they got no rent. Well, it's time for hemp. Yeah.
Thank you for taking time for Hemp. I'm your host, Casper Leitch. You are listening to the live broadcast of Time for Hemp all around the world on AmericanFreedomRadio.com and on AM/FM stations all across America. I want to thank you for tuning in this lovely Monday and give a big shout out to all my hardworking friends up in Canada, amazing activists, KDK distributors, and thank them for the grant that they give us here to keep us strong, loud, and proud. Also, I want to say thank you to the amazing team at AmericanFreedomRadio.com. They do an awesome job at raising the voice of freedom. If you like this particular program, I would encourage you to go to other broadcasts that's found on AmericanFreedomRadio.com and tune in. On the program today, we are going to pick up this Monday where we left off last Monday. We had an amazing show last Monday. We were talking about AIDS research and what's going on in the field of AIDS research. And we had on the program last week as my joint host, Ray Cristl. Ray, thank you for taking time for Hemp.
Casper, it's wonderful to be coming from Phnom Penh. It's the new year here. We had a massive blackout tonight at the end of many days of celebration, and most of the Khmer people now go to the countryside, and Thailand has their new year also, where Dr. D is in Bangkok. So we're really excited about the second installment of Dr. DeAndrea, one of the greatest speaker ever to be on American Freedom Radio, as you know. And I want to shout out to Lynette Shaw last week with Doug Willinger. That they had an incredible show, and we just last week before that Don Land, we had. Sam Morris, Peter Chris comes on every Wednesday and Thursday with Paul Stanford. People have to go with Kelly Kristen on Tuesday, just does an amazing gravitas from Canada. You have to go to the archive of Time for Hemp and really stay contemporary with this show. This is just an incredible show that Casper puts together, and to be a joint host on it, this is just a jewel in the Ray Cristl crown of just working for cannabis legalization here in Southeast Asia and Hawaii and everywhere I've been in my life.
Thank you for your very kind words and your true appreciation for the hard work that I put forward here on this project. It's nice to know that people recognize that I put a tremendous amount of myself into this project.
20 years of it, Casper, and I know I go back with Jack here or there in 91. Those were fairly dark days when 16% in the United States wanted to re-legalize cannabis hemp. And now we're, getting to numbers, thank God, that are reachable politically where we're being listened to finally. But today's show with Dr. D and coming from Thailand and his special kind of message about so many things, this man wants to bring stem cell therapy, and I've been trying to get ibogaine research in Cambodia for the crystal methamphetamine addicts than the heroin addicts here that you have in Asia.
I need to jump in here, Ray, and let people know that we're going to pay our bills, but when we come back, we got an amazing show ahead of us here at Time for Hemp.
Check this out. The voice of the revolution. American Freedom Radio. American Freedom Radio.
I'm kinda high. Let me excuse myself. But it seems like it's just moments since we met. I'm kinda high. Let me introduce myself.
Yeah, baby, let me introduce myself. My name, Casper Leitch, the name of the broadcast. Time for Hemp Live. Heard where? All around the world on AmericanFreedomRadio.com and on AM/FM stations all across America. I would encourage you to get involved in your neck of the woods to make the world a better place by going to green-aid.com. That's green-aid.com. Find out what's going on there and make a donation. And to our brothers and sisters in Japan who need help, if you want to make a donation and assist, please donate to Doctors Without Borders. Go to doctorswithoutborders.com. On the program today, we are picking up where we left off last Monday. We had Ray Cristl on as our joint host last Monday, and then we also had an amazing conversation about the topic of AIDS and AIDS research with Dr. Richard DeAndrea. And joining Ray and Dr. D today is from Chicago, Dr. Ostrow, an international AIDS researcher. And we are going to be talking about the amazing research that Dr. Andrea has been doing there in Thailand. And he's going to give us a recap. And then I'm going to rely on Dr. Ostrow to bring forth to you, my audience, some intelligent questions that I would not be able to do. With that said, I'm going to shut up and bring the program forward. I want to say hi to Ray. Thank you, Ray.
Thank you, Casper, and let's get right into it. Dr. D, are you there?
Yes, I am here. It's nice to hear you guys again. I hope you guys are doing well.
And Dr. Ostrow, are you there? Dr. Ostrow?
I don't think he's been brought on yet. Let Dr. D start and recap last week, and hopefully Adam can bring him on.
All right.
Well, in order to recap last week, let me see if I can carry this forward. Last week we were discussing specifically a treatment which is taking place here in the eastern part of the world, actually started in Africa, in which a seminal breakthrough and discovery was made in the treatment of HIV/AIDS. Specifically, this discovery was made regarding work that was done by several physicians who were actually worked in the French Foreign Legion for about 14 to 15 years on the ground in Africa. The important discovery that was made...
to my colleague, Dr. DeAngelo.
Oh, okay. Nice to meet you, Dr. Ostrow. How are you?
Good. We have met before.
Okay, good. I was just catching us up on what had happened last week. Through the work that was done in Africa through several researchers, a clinical pharmacologist who is a physician was working in Africa approximately 15 years ago on the ground doing a lot of research in AIDS. His primary discovery that was made at that time was that when he took blood from people who were in full-blown AIDS, it was very difficult to find the virus in the bloodstream. This led to many, many suppositions about what could actually be going on, but this particular physician who had worked for Pfizer and as well as several undercover organizations had led himself to believe that it was possible that the HIV virus itself was a carrier and not the actual cause of the disease, that it might be possible that it might be acting as a biowarfare device. Through his research, it was found over a period of time using stem cell therapy that when we took cells, T helper cells, which are the primary infected cells by the HIV or virus, which we're calling AIDS, that in infecting these cells that there may have been a reverse transcriptase genetic code error created at about the level of thymazine beta 4. Thymazine beta 4 is a genetic code which actually controls much of the communication of mediators, cytokines between the thymus gland and between T helper cells and T killer cells. Upon placing the stem cells in the dish with T helper cells, which are the cells that call other cells to the area of infection, the cells themselves started producing a large series of compensatory what seemed to be peptides or amino acids. The fraction of these peptides and amino acids was evaluated, and they were kept on a shelf, or they were shelved for a period of time because it was not understood exactly what to do with them. The actual seminal discovery, although the scientists had collected these series of peptides and amino acids, which are created by stem cells, were kept aside, but one of the lab workers who happened to be HIV positive, had AIDS, was a bodybuilder, had decided to take these amino acids and inject them into himself. He happened to actually be a marijuana smoker who was trying many different things, but also wanted to build muscle. He thought that injecting it the same way that you would inject an anabolic steroid 1 time a week would help grow muscle. Approximately 2 months later, he was growing muscle, and he was feeling much better, but his doctors were actually disturbed by these results, and they called the laboratory and asked specifically, "What have you done to my patient?" Nobody in the laboratory knew who the patient was until we had gone downstairs and found out that this lab tech worker with the same name then confessed that he had taken the sample off the shelf and injected himself with it 1 time a week. At approximately the 2-month mark, approximately 8 weeks, out of a hurried frustration to see whether or not there had been something affecting his T4, T8 cell counts, or that we had increased his viral load, all the tests were done to check his viral load and his T4, T8 cell counts. Upon checking these counts, what had been noticed in the 2-month period of time that his viral load had dropped by half, and his T4, T8 ratios had converted to almost normal. He had gone up in weight by approximately 4 kilograms. He also confessed at that period of time that he had also given the remedy to his boyfriend and was injecting him as well. We hurriedly took his blood as well, and it showed the same thing. At this point, since there were no negative effects occurring in the patient, and it seems as though the viral load was lowering, weight was being put on, and he had no infection, and his T4, T8s were converting to normal, we asked him how he would feel about continuing to take the amino acid. He said he would be delighted to. By 16 weeks, we checked their blood levels for virus, as well as their T4, T8 counts. By 16 weeks, their viral load was 0, both of them, and the T4, T8 cell counts had almost converted to completely normal. This had startled us. We didn't know what to do at the time, so we pulled in 1 random patient for this small clinical trial. And of course, in these cases, we never altered the drugs the patients were on. They continued to take the same drug therapy. All that happened was that the drug therapy was supplemented by an injection 1 time a week for 16 weeks. We pulled in a 3rd person into the trial randomly. He didn't know anything about it. We told him it would be used as a supplement of peptides, amino acids. He agreed with it. In 16 weeks, he had seroconverted as well. At this point, it was thought, well, we need to find probably the most endemic area with HIV/AIDS and test it there. We went to South Africa, started there, and then from South Africa with the Ministry of Health in Uganda, we went there. And then after collecting over 100 patients who had seroconverted, we went to Haiti, collected approximately 11 more there, and we are increasing that number to another 11 in Africa now. The total number as we move into Malaysia is somewhere close to 200. All of these patients at this point, with many of them stopping therapy now for several months, have no viral load. Their T4, T8s have converted to normal. They're putting weight on. Many of the patients do not want to stop using the amino acid for fear that it will come back. In 2 cases, some of the patients had to be extended to 18 weeks. We also noticed that in some patients, if we pulled them off early, 11 weeks, it seemed as though the virus level went back up, bumped up a little bit. We continued the therapy, and it went back down. So we are now moving into trials in Malaysia, and a hospital is opening up in Thailand to give us the ability to start treatment here. At this point, we cannot say that we have cured anything. What we can say is that what we are seeing is parameters that we're reversing. We never altered any drug therapy in the patients. These patients were treated we're now in 3 separate countries, moving to a 4th. And the first American patient will be coming to Thailand in approximately 4 weeks to start his treatment. So to catch everybody up with what has actually been happening, when you are asked specifically what we are believing is specifically happening, is that somehow this stem cell therapy is causing precursor T cells to be produced without any genetic markers for HIV infection, and that these precursor T cells are somehow capitalizing on being free of infection, and then we're increasing the ability of the immune system to respond. In addition to that, we know that thymazine beta-4 is also connected to CCR5, which is the entry point for the HIV virus into the T helper cell. The same allele in genetic code is also found in many of the patients who are found in Estonia, Sweden, Lithuania. There are a large number of patients, approximately 80,000, who have a natural resistance to HIV. The same allele or genetic code is near thymazine beta-4. So our supposition at this point is that there may be some kind of blocking effect taking place. We know that we are reproducing T cells, and we also believe that it is possible that this particular series of amino acids may be having an immune modulating effect, meaning that through the production of these peptides or amino acids, communication can now take place between the T helper cells and the T killer cells, so the T killer cells can be mobilized to actually attack the virus or stop it. But the important points to be remembered here is that if you follow Dr. Peter Duesberg's work at University of California, Berkeley, the question is the disease actually caused by the virus, or are chemicals causing the disease? Because at this point, what we do know, according to studies that have been printed in The Lancet, the New England Journal of Medicine, as well as the Journal of the American Medical Association, that there is a very, very high likelihood that the virus might just be a carrier. And if it is a carrier, that it might cause a genetic code error. And this creates a problem with the testing, because we already know that the ELISA test, as well as the Western blot test, are not very effective tests. In fact, we know over 88 different diseases will give an HIV-positive test, including TB. Even being immunized with a tetanus vaccine could turn up an HIV-positive test. The only conclusive way that is agreed upon, because we gave a Nobel Prize to Kerry Mullis for proving this, the only conclusive way to find the AIDS virus in the bloodstream is to use a polymerase chain reaction. Polymerase chain reaction is what Dr. Kerry Mullis won the Nobel Prize in chemistry for proving that we could actually find it. HIV antibody tests could be antibodies to reactions to viral loads. Now, the important point is that as the viral load goes up, the immune system is weakened. That it might not be so much that as soon as a person gets AIDS, they have the disease. That there may be a dependence on the amount of reserve capacity they have for the disease. Meaning that if their thymus function and if their immune function is very, very strong, they probably will have a late onset of disease. In fact, now there are studies showing that heart therapy is held off as long as possible until the person starts showing signs of immune suppression. Because we now know that using chemotherapies like AZT and some of the other substances that are in Truvada may actually accelerate damaging the immune system. So, Dr. Duesberg's, not supposition, but he tries to prove this by fact. And if you go to peterduesberg.com and spell his name out, you could look at the PowerPoint yourself. His belief and hypothesis at this point is that the person has to suffer some kind of immune deficiency, possibly secondary to chemotherapy, possibly secondary to malnutrition, possibly secondary to receiving repeated use of drugs, whether they be nitrates, poppers, cocaine, over and over again, which when you look at these drugs, there is enough research to show at this point that if a person uses nitrates and poppers, that 96% of the people who came down with the initial onset of AIDS were using those drugs and have possibly lowered their immune system to the point to allow the virus to rapidly replicate. because it uses the T helper cell as a factory. But the factory cannot be turned on until the immune veil drops low enough. So we will see then that a patient has to be close enough to the edge of the immune system to now fall to a point of failure, to allow now for it to have no defensive mechanism for continual opportunistic infection. So I raise this question. How is it that in the United States, the people who get AIDS are usually related to homosexual activities, they are drug users, or possibly related to being hemophiliacs by transfusion? But when you go to Africa, the disease does not specifically, this virus is not specific. It actually acts like a virus in Africa. It attacks people whether they were using drugs or not. So the question then is, could it be that in Africa, the reason why the disease attacks is because many of these people are not getting clean food, they're not getting clean water, they're being bitten by mosquitoes carrying endemic bacteria and viruses consistently and continually. There's a high level of TB, and the doctors in Africa are now using a protocol of just site-specifying AIDS. They don't even test for it anymore in many cases. So we don't know whether or not the HIV test itself is leading people down the road of setting them up to take the medication so that they start chemotherapy and continue to damage their immune system, allowing the virus to take greater hold. That is the point at which we are now, and we would rather just produce results and solutions rather to get into picky arguments over this subject matter.
Dr. Ostrow?
I don't know what to say here except that two things. One is that the only known case of cure that I know has been the, quote, Berlin patient. And I have to preface this by saying I'm mostly an epidemiologist and behavioral scientist, so there may be other proofs, cures, therapies that are out there. And that involves the total elimination of the immune system by radiation, followed by giving bone marrow transplants of cells that are resistant to the virus.
Yes.
And in that one patient, the virus disappeared from their blood after a certain period of time. So
Doctor,
this particular protocol is new to me. And secondly, why is this research only going on in Thailand when San Francisco, for example, has a huge number of researchers very interested in starting up trials for the type of curative procedure that was done in the Berlin patient?
After our meeting with Bill Gates, 3 scientists from the NIH came off the NIH to work for the Bill Gates Foundation. They have the substance in their possession. They are studying it now. After our meeting with Robert Mugabe and 5 ministries of health in Africa, the doctors in Africa are studying it now. After my meeting with the Prime Minister Abiset of Thailand, as well as the former Prime Minister Thaksin of Thailand, they are all studying it now.
Right.
We're producing results.
So shouldn't people wait until NIH has some data on this protocol before moving ahead?
I guess they could wait as long as they did for AZT until they fought for it.
Well, we're going to have to wait for more answers when we come back after this commercial break and a song here at Time for Hemp.
Treating Yourself Journal, the alternative medicine journal, is written and published by patients for patients.
Dr. Claudia Jensen is a clinical instructor at the University of Southern California and a practicing pediatrician who advocates the use of medicinal marijuana for the treatment of ADD and ADHD. Dr. Jensen, good evening.
Treating Yourself Journal has grown to be a worldwide source of valuable information on medical cannabis. And go to treatingyourself.com to check out previews of upcoming issues and events. Treating Yourself Journal provides patients methods on growing medical cannabis for themselves. Also, introducing healthier ways of taking their medicine. Look for Treating Yourself Journal at any Barnes & Noble and Borders bookstores. Go to treatingyourself.com and order 2 subscriptions, one for you and one for your doctor. Treating Yourself Journal, a valuable resource for the global medical cannabis movement.
You're listening to the future of talk. American Freedom Radio. This is American Freedom Radio.
Listen to Time for Hemp, hosted by Casper Leitch. Afternoons, Monday through Friday, 12 p.m. to 1 p.m. Central. Only on American Freedom Radio.
Turn out this way, but I know I remain okay. Stop talking, I'm handling business. Just watching my plan is the biggest. Hot walking and damaging rhythms. Phenomenal rocking, I'm giving them. We ready for just about anything. We steadily stirring the recipe. So heavy we're blending the chemistry. Power move molecules, stopping the enemy. It better be hitting no diggity. Give me the riff and it's written split-lickety. Beginners be getting us fidgety. Women who pretty, they really be feeling me. I'm better and clever with similes. Pleasure with metaphors deep like the river beat. The busiest bee in the witch tree looking for living and less is like it to me. No one's listening to a word I say. Maybe we can live day by day. Nobody said I'd turn out this way, but I know I remain okay. No one's listening to a word I say. Maybe we can live day by day. Nobody said I'd turn out this way, but I know I remain okay.
I'm hungry and looking for breakfast. Ganesha hang out on my necklace. Catching my obstacles, unstoppable, helping me find all my exits. Helping me drop dead weight, set me straight. Today's the day that living is living in visions are giving and making me feel like it's okay. So say what you're saying, you'll make it, be patient. I swear the bear will leave, you'll be waving in tears. Deaf people hear when blind people stare. Do you really care? Mentioning things we cleverly bring. Endings begin, I said we can sing. Sent to the heavens, with gentle weapons we made to be strong. It didn't take long.
No one's listening to a word I say. Maybe we could live day by day. Nobody said I'd turn out this way, but I know I remain okay. No one's listening to a word I say. Maybe we could live day by day. Nobody said I'd turn out this way, but I know I remain okay.
People know the truth. Tell everybody how important it is that we take marijuana, i.e. hemp, off of Schedule 1. that it really does have medicinal purposes, that it is a lie when they say there is no medical value to this plant. Get a hold of your congressman and your senator and let them know that you know the truth. On the program today, we are having an amazing conversation with some hardworking activists all around the world. We have my joint host, Ray Cristl, our joint guest, Dr. Richard DeAndrea, and Dr. Ostrow. And we are having a very interesting conversation on the topic of AIDS. Dr. Ostrow's last question to Dr. DeAndrea was, why is this not on the doorsteps of the people who are doing research in San Francisco, which, by the way, you are coming to San Francisco and doing a big press announcement in about 10 days, and that's cool. But a brief answer to that, so Dr. Ostrow can also ask a few more questions.
I think Dr. Ostrow asked a very important question, and I think that some things we have to start looking at this a little bit differently. I think the way that we are looking at it is going down a road in which we're seeing this virus as something more than what it actually may be. I will give him two pieces of data that I think he will find very useful that may point in a different direction. The first piece of data that was printed as early as 1994 on November 10th by the AIDS Research Humanitarian Foundation Retroviruses was called the modulation of cellular gene expression of HIV type 1 infection determined by subtractive hybridization and downregulation of thymazine beta-4 in vitro and in vivo. This original work was done at the Molecular Virology Laboratory at St. Luke's Roosevelt Hospital Center in New York City. The conclusion was that these results indicate that HIV-1 infection may directly influence the expression of certain physiologically important peptides. In reality, all we are adding back to the body is peptides. A second piece of data, which comes from the journal AIDS in 1989, says the possibility of HIV, GP41, and thymazine beta-4 sharing the same antigenic epitope. Specifically in this, the review challenges the strategy that it's possible that to date there might be novel entry inhibitors that could affect or disrupt GP120 and GP41, which are the two entry markers for where HIV enters the cells. The only supposition that we're making at this point, and there is only one thing that we're doing, we are not adding chemotherapy. We're not adding a drug. There is no side effect. All these amino acids and peptides are amino acids and peptides already known to the body, but they have to be found in the right combination and concentration. And in addition to that, since stem cells are involved, what we're beginning to see is that perhaps these peptides that we're giving are having an effect, like a thymic peptide effect, that increases the proliferation of uninfected T cells from stem cell precursors. If anything, what we know that we are doing is causing an immune boosting effect, and if we gave it only as a supplement and did not change medications, which we have done in over 200 cases at this point, and it had produced the effect it is already producing, and many of these patients have come off their drugs. We did not ask them to come off their drugs. They've done it on their own. They continue in some cases to continue taking the peptides. In other cases, they do not. And we still see the same result with no side effects. So the decision at this point has to be made that we extend the clinical trial as far as we can and extend it to as many research organizations as possible until people start stepping up and putting the money into supporting the research and moving in a possibly different direction.
Dr. Ostrow?
Well, it sounds good to me, but the ifs are pretty big there. So I just want to be sure that what goes out in terms of PR and information doesn't stress that this is, proven to be a cure, but is another step towards that.
Did I say that word, ever?
No, but that's how I was. This discussion was described to me earlier.
That's how I said to him that you never said the word cure because we never can say that when it comes to AIDS, but you were able to bring it to a halt in the blood system. You were able to put it to rest. And I was just trying to explain in layman's terms what you've just so eloquently said in physician terms. And you're right. You never did say the word cure.
Let me say something that I think a lot of physicians need to learn. Curing is for pickles. Healing is for people. Healing takes time. The concept of getting doctors into the mental capacity of believing that everything is going to be cured has made it so that they're only operating in their left brain. In the right brain, they'd be using more of their brain capacity. As Einstein said, we're not using full brain capacity. And it is very possible that we have trained doctors to think in such a manner that they can't think themselves in any other way but to outsmart themselves. And I think that the concept of a cure has cornered doctors rather than opening up the variable options to healing and saying, are there many factors? Could we be looking in many different directions at the same time for an answer? This only brings me to a story that I was once told by a monk. And this story is about these blind men. 5 of them go into a room. And each one of them goes in there and then comes out and tries to describe what it is that is in the room. The first one goes in the room, and he comes out and he says, I know what it is. It's a fire hose. The next one goes into the room and he says, I know what it is. It's a giant wall. Third one goes into the room and he says, I think it's a tree trunk. Fourth one goes into the room, he says, I think it might be a broom. The fifth one didn't go in the room. He just listened to all the other ones and he said, it sounds to me like there's an elephant in the room. I think that if we start to actually use a different focus, we might be able to begin to see a little bit differently. And the continued focus on the idea of a cure, when in many cases they keep saying that they're going to cure cancer, but the people I see who've actually put pancreatic cancer in remission for close to 14 years now in Germany are using hyperthermia therapy, they're using intravenous ozone therapy. I could actually give you links to these clinics. I could also give you clinics in Mexico called the Oasis of Hope, which are using integrative cancer therapies, in which we may use chemotherapy for a period of time. But the one thing we definitely do know, if we look at cancer itself, is that Dr. Otto Warburg won the Nobel Prize in 1941 for proving that cancer cannot grow in a high oxygen environment. Should it not be then that we should oxygenate these patients? We also know that cancer feeds on sugar tremendously. In the United States of America, we know that people are eating high fructose corn syrup like it's going out of style. It's in cans of soda. It's being put in all the food. We're actually feeding cancer. Cancer creates an acidic environment. If we actually went on YouTube and you actually put in something like cancer is fungus, you might notice that an oncologist at the University of Rome is actually doing drips of sodium bicarbonate directly into lung cancer, and he will show you on YouTube himself with scans that he is reducing the size of lung cancer by alkalinizing the tissue, because all cancer is surrounded in an acidic medium, which makes it difficult for the cells to access oxygen. So they specifically go for sugar, and the byproduct of that sugar consumption is to produce more acid. So the question would be that maybe the focus on cancer is a little bit different. Instead of looking at it as something so terrible, what I like to think of it is it as a process with a purpose. It has a purpose, and its purpose might be to actually stabilize the body for a period of time as it tries to take care of something, as the body continually goes through this composting effect. Because changing the internal medium to an acidic environment, lowering the oxygen, increasing the sugars, is the same thing that we see happen to vegetable matter. So if we were just to use some farming principles that we might get from growing marijuana, and I've actually grown it myself, and I learned a lot about handling ICU patients from growing marijuana. Because if you know something about marijuana and you know something about farming, what you begin to see is that everything that Paracelsus has said, he said that a doctor's job is to stand by and watch nature do the work. And if we begin to put stem cells to work, which is the power of nature in our own bodies, then we're putting a force of nature to work by capitalizing on taking us from 40 million stem cells in the bloodstream, and at a minimum, in my own body, myself, I got an IV drip of my own stem cells derived from adipose tissue of approximately 900 million. At the same time, they injected them into my knee, which was fractured in 4 places, 2 ligaments were avulsed, and the disc on the left side was completely lost. After injecting it into my knee, in approximately 2 months and 3 weeks, I was walking, and now I am walking without a cane. So what we're seeing is rapid regeneration using stem cells. In my own clinic, I've infused stem cells by IV drip in stroke patients, reduced the size of the stroke by half. We have actually done a clinical trial in Greece on autism patients. 80% of the kids we have treated now are back matriculated in regular school. We have also finished a recent study with the US FDA on type 2 diabetes using stem cell therapy. We specifically have reversed reversed type 2 diabetes, and we've actually brought blood sugars from an average as high as 368 to 400 down to 100 in approximately 6 weeks and converted hemoglobin A1C to normal, opening a window for treatment that could be capitalized by using dietary therapy, herbs, acupuncture in order to stabilize the patient. We have also taken PRP, which is protein-rich plasma, mixed with stem cells, injected in the neuropathic sites around the damaged tissue, which comes from diabetic neuropathy, resolved that, rebuilt an entire bone by reconstructing the bone using stem cells, built the ligaments as well, and also reconstructed the entire foot and got a diabetic out of a wheelchair, and he is now walking without a cane.
Okay, now we got to stop here, and when we come back, we're going to give Dr. Ostrow a chance to ask another question or two when we come back from commercial break here at Time for Hemp.
THCF Medical Clinics are the premier medical marijuana physicians clinic in the USA. THCF has offices across the United States from Hawaii to Michigan and in California, Oregon, Washington State, Montana, Nevada, and Colorado. THCF Medical Clinics has helped approximately 150,000 medical marijuana patients obtain their permits to legally possess, use, and grow marijuana. If you have chronic pain, multiple sclerosis, or other neurodegenerative diseases, gastrointestinal disorders such as GERD, IBS, AIDS, cancer, spastic conditions, seizure disorders, or glaucoma, call us at 1-800-723-0188 or go to hemp.org. That's HEMP.org. THCF Medical Clinics at 1-800-723-0188.
News and information you can trust. This is American Freedom Radio. Freedom, American Freedom Radio. American Freedom Radio.
Well, let's had a bowl, good spring reefer, a big fat Joe beef, much sweeter. I don't hide it. I don't hide it. Well, I don't hide it. I don't hide it. Well, I don't hide it. Fire up right now.
Yeah, baby. Fire up right now. Be loud, be proud. Let everybody know that you are a marijuana smoker. Go to NORML.org and find a chapter in your neck of the woods to make a difference. On the program today, we are talking about AIDS research. And Dr. Ostrow, we want to make certain that you have an opportunity to ask another question that might be sitting on your brain.
Well, the question before was going to be, what is the reason that Dr. DeAngelo has the same interest that I have, crossing between HIV and medical cannabis? But I think you've answered it in what you said later about your other work. So my question now is, as a person who's been living with both HIV and type 2 diabetes, where can I sign up for the stem cell cure of my diabetes?
Okay, I won't call it a cure again, but basically, if you go to our website, which is globalstemcells.com, globalstemcells.com, that website, there's a couple of things being adjusted, but it is up. You could look at all of our data on diabetes. As far as the HIV treatment goes, we would have you come here, and we would do the treatment out of my clinic. We would like you to possibly stay here, and I know it might not be possible to stay for 16 weeks. I would rather have you here the whole time. I don't feel comfortable at this point sending you away with the remedy. I want to make sure it's injected properly, the protocols are followed properly. Basically, the treatment is very simple. We give you one injection of approximately 5 cc's of fluid intramuscularly once a week for 16 weeks. That's all that we do. We don't ask you to alter your medication. You can contact us through that website. That same website will be used when I go to San Francisco. You can also contact me at Dr. DeAndrea, DRDEANDREA, at globalstemcells.com. Through these two routes, it is easy to contact us. Most likely you will be contacted by the business manager. His name is John Wood, and he would determine with you how it would be possible that we could bring you for the possible treatment so that you can have the results. That's specifically how we do make contact at this point. We choose to continue to collect data in clinical trial. We do not make a supposition about having a cure. We just feel at this point that it can be used for supplementation. The patient can choose to take it as supplementation, choose what they'd like with their own doctor about how they use their medications. We've had no side effects to the use of this substance. They are amino acids which are known to the human body. They were derived from stem cells. In addition to that, what would be really nice would be to do a mini liposuction procedure on you in approximately 40 minutes. I take your fat, take the stem cells from your fat, prepare them, take a little bit of your plasma, mix them together. At the end of approximately 1.5 hours, you'll be out of the OR. We all do this all under local anesthesia. You'll be up in your room with an IV drip. The IV drip will be dripping your stem cells back into your bloodstream. At that point, I would probably give you some protocol to go home, make dietary changes, make sure that you work with an acupuncture, Chinese medical doctor, and most likely your diabetes, your type 2 diabetes would stabilize. But another thing to consider when considering all of this is that if there is type 2 diabetes there, and there is this immune process going on, there's a high level of inflammatory factors going on. We have other peptides which we are working from, which are derived from stem cell therapy, which can actually reduce inflammation. We've been able to alter interleukin-1s to decrease the inflammation associated with metastases. So we're not exactly releasing that yet, but that will be coming up in the near future. We have also created a peptide which can substitute even for Botox to create a filler effect without damaging muscles and nerves. We've developed a number of other peptides because we believe that at this point the future is going to be in using factors that we could find in cytokines and mediators from the body, right, because these are the things controlling function.
All right, now we've only got a couple more minutes, so I want to give Dr. Ostrow another chance for another question.
Well, it's more like an observation. You can understand why I said a cure for diabetes, because my assumption is, and again, I'm not a basic cellular biologist, is that if one is reconstituting basically pancreatic function with stem cells, that should be something that once done continues for as long as those stem cells survive in your body.
It works for type 2 diabetes, not for type 1.
Right, and that's
type
what
1,
my family has.
I will tell you who I believe is getting the greatest breakthroughs with type 1, but it's very difficult to get their data.
Mm-hmm.
That would be Beike in China. But they do not share their data, and China holds their data. I do know that they have people who have spinal cord injury who are walking again. I've seen the video, I've spoken to the doctors, but that's all they do release. But in China, you can open up a pancreas and put stem cells in it, and there's no problem with that. You just can't do that anywhere in the world. So the people who are having the most dramatic results with type 1 are in China. They are taking cord blood, growing it out and incubating it, and then they're apparently implanting it inside the pancreas. That's what they're doing. But I can't say that I know their data, but I would say that if somebody asked me with type 1 diabetes where to go, I'd send them to them.
All right, we got about a minute left, so Dr. Ostrow, you want to give a shout-out to a website?
My own?
Yes, go ahead.
I don't have a website, but anybody can reach me at DOSTROW, DOSTROW, at UChicago, for University of Chicago, .edu.
All right, and Dr. Richard?
Again, you can contact me at globalstemcells.com or Dr. DeAndrea, DeAndrea, with no period included in there, at globalstemcells with an S.com.
And Ray Cristl, I want to thank you for being the joint host today.
Casper, I want to tell your audience they've never heard anything like this before. To download these shows with Dr. D'Angelo and listen over and over again, and to please send some money your way to keep you happy and smiling in Portland. I'll see you next Monday, buddy.
Thank you. And tomorrow we're going to be saluting all of our friends in Canada here at Time for Hemp.
The money that they spend, take another look and spend some time for him. Don't cut trees for paper, 'cause it hurts the environment. Stop deforestation, yes, it's time for him. Whoa, an acre of hemp makes 20 bales of oil. No need for pesticides to poison all our soil. People got no food, they got no clothes, they got no rent. Well, time for help! Yeah!
Following a radiological or nuclear event, radioactive iodine may be released into the air and then be breathed into the lungs. Radioactive iodine may also contaminate the local food supply and get into the body through food or through drink. When radioactive materials get into the body through breathing, eating or drinking, the thyroid gland quickly absorbs the chemical. Radioactive iodine absorbed by the thyroid can then injure the gland. But you can protect yourself with use potassium iodide, which acts to block radioactive iodine from being taken into the thyroid gland and can help protect this gland from injury. To take advantage of very special rates, click on the banner at AmericanFreedomRadio.com. And don't forget our convenient delivery service, Ideal Health New Zealand, leaders in alternative health. That's AmericanFreedomRadio.com and click on the Ideal Health New Zealand button. Proudly brought to you by the VinnieEastwoodShow.com.
Heart-related health problems affect millions of people each year. Maybe you're one of the many who suffer from issues related to angina pain, high blood pressure, congestive heart failure, unbalanced cholesterol, irregular heartbeat, or clogged arteries. There is a solution that doesn't involve expensive prescription drugs that only mask the problem and leave you with horrible side effects. If you are ready to live your life free of sickness, pain, and fear, live your life with increased vitality, energy, and youthfulness, and experience your body healing itself, then you're ready for Heart and Body Extract from Healthy Hearts Club. Heart and Body Extract has a 23-year proven track record of using certified organic herbs that make up an excellent formula to balance and support the heart and circulatory system. In as little as 2 weeks, you can feel amazing results when your 2-month supply of Heart and Body Extract today. Call 1-866-295-5305 or go to hbextract.com.
Welcome.
We're now in the approach phase. Everything looking good. Control is good. 5. Roger, copy. 3. 2. 1. Okay.
Prepare your mind to experience American Freedom Radio.